Okay, welcome everybody. This is Chapter 3 in Human Diseases by Neighbors and Jones. And what we're going to talk about today is neoplasms. Now, neoplasms are essentially transformations of normal tissue in which they move away from serving their normal purpose in the human body and become what we call cancers. And essentially, the way cancer operates is that due to uncontrolled cell division and the need for that growing tissue mass for oxygen, for fuel, and its increase in size, increase in growth, eventually what happens is that the host organism, in this case the human with the cancer, ends up getting sapped of oxygen and nutrients, and as a result basically starves to death internally at the expense of the host. The cancer continues to grow. So what we're going to look at is how cancer occurs and how cancer can be treated.
What is cancer? Contrary to what many people believe, cancer isn't just one disease. There are more than 100 common types of cancer and many more subtypes, which can occur anywhere in the body. Sarcomas are cancers that originate in muscle, fibrous tissue, or fat, known as soft tissue sarcomas, or in bone and cartilage. Leukemias are cancers of the blood cells, arising in the blood-forming organs, bone marrow, and the spleen. Lymphomas affect the lymphatic system, a network of vessels and nodes that acts as the body's filter. There are at least 30 and perhaps more different types of lymphomas. Carcinomas, the most common cancers, arise in the body's organs. About 80% of all cancers are carcinomas. Examples are cancers of the breast, prostate, stomach, colon, and as the skin is an organ, also include squamous and basal cell skin cancers. There are a few cancers that don't fit into these major categories. Melanomas, for example, are not considered carcinomas even though they arise from skin cells, and certain types of brain tumors have their own classification. Cancer begins in the body's cells. All parts of the body, organs, muscles, skin, even bones and blood, are composed of cells. Cells are constantly dividing and multiplying to replace old, damaged cells. Dividing is part of a normal cell's lifespan. Cells grow, divide, and die in an orderly fashion. However, if this orderly process is disrupted and cells begin to grow out of control, they form excess tissue known as a tumor. In most cases, tumors are benign, meaning that they are not cancerous. Benign tumors can occur almost anywhere. Although they may cause some health problems depending on their size and location and may have to be removed, they are usually not life-threatening. However, if cells are cancer cells, they grow, divide, and eventually form malignant tumors. Malignant tumors, unlike benign tumors, invade and destroy surrounding tissues and nearby organs. Eventually, cancer cells break off and spread through the blood or lymphatic system to form new tumors in other parts of the body. This process, the spread of cancer from its original site, is known as metastasis. Cancers that originate in the breast or colon, for example, typically metastasize to the brain, lung, liver, or bone, forming new tumors there. Metastasis can be a slow process occurring over a number of years, or can happen rapidly within a few weeks. Scientists are not sure why. Left untreated, cancers continue to grow, invade, and spread, taking over and destroying the organs where they originate, as well as those to which they spread and metastasize. As this happens, the person will eventually begin to experience symptoms related to the organs affected. To understand what causes cancer to occur, we must look deeper into the cell, at the genes that control the cell's growth and behavior, and how the cell's normal function may be disrupted or damaged. Since it is the genes that regulate the normal, orderly behavior of cells, abnormalities or damage to cells' genetic components cause them to behave abnormally, to become cancers. In some cases, people have inherited genes that may predispose them to cancer, while in other cases, genes are damaged by external environmental factors, such as smoking, exposure to chemicals or ultraviolet radiation, and perhaps even viruses. Not all of the causes of genetic cell damage are known, and in many cases it's probably not one, but a combination of factors.
There are still many unknowns. Research has unraveled many of the mysteries of cancer, and new discoveries are happening every day. The more we learn about cancer, the more targeted and specialized our therapies are becoming. There was a time, not too long ago, when a diagnosis of cancer was perhaps the worst medical news you could receive. But today, if you or someone you love has cancer, it's important to remember that many cancers that were once fatal are now curable, and many more are treatable than ever before in history.
This animation will show how cancer develops. Cancer is caused by the cells of the body changing so that they grow in an uncontrolled way. Click the navigation arrows below the animation screen to play, pause, rewind or fast forward the animation. Your body is made up of cells. Nearly all the cells in the body have a nucleus, which is the control center of the cell. The nucleus contains genes, which control everything about the cell, including how the cell grows and when it will die. Damage to genes is the underlying cause of cancer. The damage may be inherited or caused by other factors, such as cigarette smoke. The cells of your body divide to make more cells, so that your organs and tissues can grow and repair themselves. The nucleus controls this division. In cancer, the cells divide in an uncontrolled way, and often more quickly than normal cells. In many cases, the cells form a lump called a tumour. Cancerous tumours can spread into surrounding normal tissue. Not all tumours are cancerous. Some do not infiltrate the surrounding tissues, nor do they spread to other parts of the body. These are known as benign tumours. Tumours that invade the surrounding tissue and spread to other parts of the body are known as malignant tumours or cancer. Cancer cells can invade blood and lymph vessels. These provide a route for spread to other parts of the body to form secondary cancers. This is called metastasis. This is the end of the animation. Click on the animation screen to watch it again.
So when we're talking about cancer, we're talking about a transition of a cell from a differentiated and functioning state in the body where it serves some sort of greater purpose, for instance, in the context of a tissue, to essentially being an uncontrolled growth. When the body's healthy, cells grow in an orderly fashion, and there are systems in place that prevent them from reproducing too quickly. Some of these are within the cell itself, things like contact inhibition, where a cell will only divide until it makes contact with its near neighbors. Others include chemical signals that come from other cells that help control growth. And there are also biochemical checkpoints within the cell that keep it from undergoing mitosis at too rapid a rate. But occasionally what happens is that these conditions are altered, and this triggers a change in the way that the cell decides to divide and when to divide. This uncontrolled reproduction leads to too many cells being produced, and this creates a lump or a tumor. Tumors can either be what we call benign or malignant. Now, this change that takes place could be a change that happens within the cell. It could be a result of a change in the genetic material that controls the events of mitosis, which is how cells divide. It tells the cell when to duplicate its DNA and then when to undergo what we call cytokinesis, which is the division of the rest of the cell components into two new daughter cells. And if you think about the number of genes that could potentially control this condition, you're talking hundreds of potential targets where something could go wrong. So what sort of change could cause these genes to go out of control? It could be something like a mutation. Basically, by changing the sequence of a gene that controls cell division, we can cause cell division to run in an unchecked fashion. Another way that we can induce this uncontrolled cell division is by another tissue in the body producing an excessive amount of growth factor. And growth factor is basically a chemical signal that tells distant targets to begin to divide. And what might have happened in this particular tissue is either a breakdown of the control system that causes the cell to secrete these growth factors in a homeostatic fashion, in a well-regulated fashion, to secreting them in an abnormal fashion. The cell that produces the growth factor itself could become a tumor cell that overproduces that particular chemical signal. And then when it's pumped throughout the body through the action of the circulatory system, or if the growth factor is affecting nearby cells as a paracrine messenger, what can happen is that the cells can begin to divide in an uncontrolled fashion. So let's take a look at these tumors. A benign tumor usually has slow growth, and it tends to push healthy cells out of the way, but it's not generally life-threatening depending on where it occurs. Benign tumors can be life-threatening if they occur in the brain, for instance, and the mere increase in intracranial pressure as a result of the growing mass can crush neurons, causing them to die and causing you to lose brain function. But generally speaking, what happens with benign tumors is that they increase in size, but they stay in one particular area. Often, benign tumors can be resected, and that usually takes care of the condition. Malignant tumors are different. Malignant tumors show rapid growth, and they tend to invade healthy tissues in a process called metastasis. That's metastasis, metastasis. What happens in metastasis is that cells that aren't cancer cells yet hitch a ride in the circulatory system or in the lymphatic system, and as a result of the movement of those fluids throughout the body, they get carried to other tissue compartments where they can set up camp, begin to divide, and produce new tumor masses wherever they happen to live. They can enter the blood or the lymph, starting new tumors in other parts of the body. And the problem, of course, with this is that if we get too many growing tissue masses in too many locations in the body, then we're going to rapidly drain the body's metabolic resources, and death will follow. Let's take a look at some specific types of cancers. Leukemia is malignancy of the bone marrow, and what happens in leukemia is we make large numbers of abnormal white blood cells, or leukocytes. Leuko means white. And what happens with these large numbers of leukocytes is that they're not capable of doing their normal job in the body, which is to fight disease. And as a result, they flood the lymphatic tissues and the circulatory system, and they keep the mature lymphocytes, the mature white blood cells, from effectively doing their job. So one of the unusual findings in people with leukemia is that you see an increased incidence of infection and also an increased incidence of cancer for reasons that I'll explain in a moment, while you have a very high white count. And the reason for this is that that high white count is not a sign of a large number of white cells that are capable of fighting disease, and as a result, you're more likely to get sick. Now, let's talk for a minute about why it is that you see increased rates of cancer in people that have um, a malfunctioning immune system, leukemia being one of the many malfunctions that the immune system can undergo. One of the jobs of the immune system is to patrol the body in an activity known as immune surveillance. And what happens is that white blood cells basically walk the beat of the entire body, looking for any unusual changes that they encounter in differentiated, fully functioning tissue. These changes are usually present in the form of unusual molecules on the surfaces of the cells, which are called antigens. If these antigens are not similar to your body's normal antigens, that will tag the cell for destruction. And what will happen is that the lymphatic system will move in and try and wipe that cell out before it gets a chance to become a malignant neoplasm. But in individuals that have suppressed immune systems or malfunctioning immune systems, this surveillance activity is ineffective. And so with your everyday living, whether you realize it or not, and all the events that go on inside the human body, you generally get cancer 1 or 2 times a day, even though you don't realize it. But the reason that these don't develop into malignant neoplasms is because of the immune surveillance function of the immune system, which takes those cells out before they get a chance to cause trouble. But in individuals that have malfunctioning immune systems, that doesn't happen, and these spontaneous cancer rates end up producing now cells that can move off and invade the body and cause all kinds of problems. A hematoma is basically an internal bleeding. It's a bruise or a contusion. If we look here at an example of a hematoma, what you see is blood underneath the skin. The reason that it looks sort of bluish black is because it has a tendency to coagulate even if it's not coming out of an open wound. Let's look at some classifications of neoplasms. Cancer is a general term for a malignant tumor or neoplasm. So this is the all-encompassing definition that we use when we talk about any kind of abnormal tissue growth that threatens the normal functioning of the human body. But within that group, within the term cancer, there are a bunch of subcategories. They're classified according to the appearance and their growth pattern and the type of body tissue that they come from. And this is just a look at how we break these up. So here we have neoplasms, which are cancers. And then we can break these into either benign neoplasms, which generally produce contained tissue pockets that don't spread, and they don't have the ability to metastasize. And then we can go over here and we look at malignant neoplasms, which have the ability to spread. And under this category, we find epithelial malignancies, we find connective tissue malignancies, and we find leukemias. Epithelial malignancies are called carcinomas, connective tissue malignancies are called sarcomas, and white blood cell cancer is termed leukemia, leuke meaning white again, and emia in this case referring to the cancerous growth. So if you think about this now, you have to remember the tissues of the body, and if you go back and remember epithelial tissue, what you should recall is that epithelial tissue is characterized by having large number of cells that are closely packed together, and there's not a lot of extracellular material between them. And when you look at epithelial tissue itself, these tightly packed cells come in different forms. They do slightly different jobs. You have the epithelial tissue proper that provides the outer covering of the skin that makes up most of the cells of the epithelium. But you also have cells that produce pigment, and these are called melanocytes. They generate a pigment called melanin. You also have nerve endings. You have a considerable amount of lymphatic tissue wandering throughout the epithelium. And what these do is look around for any pathogens that may have managed to make it through those outer epithelial layers. And you can have a cancerous event in any of these tissue types. So let's talk about tumors for a minute. Tumors can be benign, meaning they're confined to a local area, or malignant, meaning they have the ability to spread from their original location. Carcinomas represent the largest group of malignancies to which we can refer. Lymphomas are malignant neoplasms of blood-forming organs and lymphatic tissues, while sarcomas are neoplasms that come from connective tissue. Now remember that connective tissue is different from epithelial tissue in that it generally has very few cells and lots of extracellular matrix. Examples of liquid connective tissue include blood and lymph, and of solid connective tissue include loose connective tissue proper and dense connective tissue like you might find in tendons and ligaments, as well as fat, which is a type of connective tissue, bone, and cartilage, all different types of connective tissue. But they all have one characteristic in common, which is that they primarily consist of extracellular matrix and not so much actual cellular components. Melanomas are malignant neoplasms from melanocytes. Remember that melanocytes are the cells that produce pigment in the epithelium. This is one of our safeguards against the damaging effects of the UV radiation that comes from the sun. What happens when UV radiation hits our skin is not only does our skin warm up, but this UV radiation represents a type of electromagnetic energy, and that power can be translated into the molecules that make up our living tissues, and one of those molecules is DNA. And when UV radiation strikes DNA, very often what can happen is that you can break covalent bonds and make new covalent bonds, and this can result in a mutation in the DNA, which could lead to a transformation such as cancer. When you have a lot of melanin around intercepting the UV rays, the damage is minimized. Gliomas are tumors of glial cells that come from the brain. Glial cells essentially are the neuron's personal assistants, and what they do is take care of cellular processes that the neuron doesn't have time to attend to in its day-to-day activities. These are things such as insulating the axon that carries the electrical signal away from the nerve cell body, defending the nerve cell against invaders, against disease, and providing the nerve cells with nourishment. And if you have a cancerous change in any of these cell types, what we can end up with is a glioma. Generally speaking, the tissues in which you're going to find cancer occur are those tissues that divide the most frequently. And the reason for that is that every time a cell divides, this represents the opportunity for a mistake to be made in the genetic material. Nothing is perfect except God, and that includes the processes that govern cell division. So what can happen as cells rapidly divide is that very low, admittedly very low error rate can add up, and eventually what can happen is that a mutation may not get repaired in time for it to be passed on to the next cell, and if that mutation occurs in a gene that controls the active cell division, that cell could begin to divide in a very rapid fashion. Okay. Benign tumors have growth in a particular area, but they're not invasive or metastatic. They tend to be enclosed in a capsule, and they're easier to remove as a result. And they have limited growth potential. But malignant tumors are different. They are generally without structure or function of normal cells. They don't really do anything except consume fuel and oxygen and grow. They don't really serve the body in any real or immediate sense. Their surface area is also not encapsulated, and they have the ability to spread through the process of metastasis. So what are our options for treatment? Well, there's preventative options. These are changes in your lifestyle that can reduce the incidence of neoplasm formation. Preventative options will keep the disease from beginning. Palliative options are basically what we use once the cancer has progressed to the point that we really can't stop it anymore, and these are designed simply to relieve pain and provide comfort to the patient. But it's not going to cure the disease. The only way really to cure something like metastatic cancer is to ultimately either completely wipe out the rapidly dividing tissue, and there are several ways to do that we'll discuss, or ultimately to try and fix the mistake that caused the problem in the first place, which is a very daunting task. Other options that have been tried include attempting to starve the growing tissue mass of blood, and that's shown some success in certain cases, as well as attempting to tag the cancer tissue with antigens that will warn the lymphatic system of their presence and sort of try and recruit the white blood cells in an effort to attack and destroy the growing tissue, and that has shown some success in certain treatments as well. What are the differences between hyperplasias and neoplasms? Well, both mean an overgrowth of cells causing an increase in tissue size, and they produce masses identified as hyperplasias or neoplasms, but the differences include the cause and the extent of the growth. How do malignant neoplasms develop? Well, genetic mutations can occur due to radiation, viruses, carcinogens, which are chemicals that can attach to the genetic material and change its sequence, and other types of chemicals that can alter the sequence of DNA. The bottom line is that any of these can change the arrangement of nucleotides in the DNA molecule, and if that change is in a gene that affects cell division, the potential is there for the tissue to go from normal to cancerous. Let's look at the development of malignant neoplasms. Carcinoma in situ, meaning within the confines of the living tissue that you find it, are generally atypical cells in the epithelial layer of the tissue. They have yet to invade the surrounding tissue, so they're not metastatic yet. What can follow is invasion of precancerous cells, which is the final stage in cancer development. And the idea here is that these unusual cells, these mutated cells, can introduce themselves into healthy tissue and begin to grow. Next thing that happens is invasion and metastasis. Carcinomas and epithelial tissue neoplasms commonly spread. The lymph nodes filter the cancer cells out because of their ability to move. They often hitch a ride in the lymphatic system in an attempt to spread around the body, but lymph nodes can trap them. The absence of lymph node involvement is a favorable sign, because what this means is that it's entirely possible that using things like chemotherapy and radiation therapy, we have a fighting chance to actually knock the cancer out before it attempts to spread any further. Sarcomas have the ability to shed cells into the bloodstream, and if they get into the circulatory system, what can happen is that they can travel all over the body in a relatively short period of time and then begin to set up new sites of metastatic cancer in almost any body compartment, including the nervous system and the bone marrow. So let's take a look at cancer metastasizing.
The term neoplasm means new growth. Neoplasms may be benign, a growth that is generally harmless, or malignant, a growth that invades other tissue. Any malignant tumor is also known as cancer. Normal cells grow and function for a specific purpose. In cancer cells, the growth pattern is haphazard, has no specific pattern, and invades other tissue. Metastasis is the spread of the neoplasm to distant sites. Just the way plants send their roots into the soil, the finger-like projections of cancer force their way along the lines of least resistance and spread to other sites. The lungs are a common site of a carcinoma. The cancer cells invade the lung tissue. The cancer cells move from the lungs into the lymph system. As more and more cancer cells enter the lymph system, the cancer cells may spill over and enter the bloodstream. The cancer cells of the epithelial tissue, also known as carcinoma, metastasize from the lung into the lymph, then the general circulation, and metastasize to the liver. Cancer cells of connective tissue, also known as sarcoma, shown here in the thyroid gland, move directly into the general circulation. The cancer cells then metastasize to another site such as the bone. Cancer of the epithelial tissue metastasizes through the lymph tissue and blood. Cancer of the connective tissue metastasizes through the blood.
Okay, one of the ways that we determine the extent to which the cancer has affected the healthy individual is to determine the degree of abnormality of the cancer. This is called grading of the cancer. And staging of the cancer is a way to measure how much it is spread. So what I'd like to do here is take a look at how we grade and stage cancer.
Knowing the language makes navigating through Cancerland a lot easier. It also helps us feel more in control of our destinies because we can make better decisions when we understand the lingo. Today, Dr. Erba and Dr. Ellen Atopa Johnson will discuss grade and stage, two words that take on a new meaning after a cancer diagnosis and greatly influence both the course of treatment and prognosis. We'll also look at how our individual biology influences both the cancer and approach to treatment.
What happens in cancer is that there's a breakdown in that organization such that the relationship between cells to one another is lost. And part of that relationship requires an organizational closeness. During the cancer process, it's advantageous to the cancer cell for its own long-term survival to depart from that organization and start to spread to other places.
Staging is the process that the clinician does with the patient. So once a diagnosis is made, we want to know where in the body that tumor is for a number of reasons. One is to tell what type of therapy the patient should receive. So for example, if it's an early stage or low stage and localized to an organ, it can often be cured with surgery or radiation therapy alone or a combination, as opposed to more advanced stage where the disease is already spread and you have to think about more systemic therapies, treatments that go everywhere in the body to take care of the disease. And so a clinician will do a staging evaluation to look at prognosis and also come up with the best therapy. The tests that are done in that staging evaluation depends on the clinician's knowledge of what that tumor normally does. So for example, if we had a scan of toenails, we're not going to do a scan of toenails in a person with lung cancer because we know lung cancer doesn't go to toenails.
So histologic grade, the grading is a description of the microscopic appearance of the cells. It is informative to the clinician in that it depicts the degree of abnormality of the cells. When you assign a high histologic grade to a cell, it implicitly informs the clinician that this is a tumor with a tendency to an aggressive clinical course. Now, ideally, that information is also going to be conveyed in the context of stage, which Dr. Erba described earlier, which is the clinical evaluation of the extent to which the tumor has spread from its primary site of origin. So high grade does not mean high stage. And high stage does not mean high grade. It just conveys some of the biological properties. When you see the grade, you'll say this is likely to be an aggressive tumor, and there's a system by which numbers are assigned to give an indication of how aggressive histologically, that is microscopically, the tumor looks.
So one issue for people to understand, and which is difficult, is cancer is not always the same. It isn't the same in different people. And so it's not one disease. These cancers of different organs behave very differently and have different underlying events, genetic changes that lead to them. But moreover, we are learning that even when we look at something under the microscope and we say, aha, that's breast cancer, or that's prostate cancer, or lung cancer, that there can be differences between that cancer, the genetics of that cancer in different people. And that's what we're investigating right now. And what we are finding in a variety of malignancies is how heterogeneous these cancers are. That brings up the challenge. It's the hope for the future, because by getting these samples from our patients and evaluating these genetic changes, typically done in pathology labs and molecular diagnostic labs, we are going to learn about the biology of the disease, and hopefully in the future be able to have better drugs that can interfere with the cancer process. But that process may be very different in one person or another person with the same disease under the microscope. So it's quite a challenge, and it really underscores the importance of people with cancer allowing biopsies to be taken for research purposes so we can understand this heterogeneity of the tumor, which will ultimately lead to much better therapies than what we have today.
Okay. The prognosis for cancer is determined by the stage at diagnosis, and there's two strategies for staging cancer. Staging is based on the amount of metastasis, in other words, how much it's spread from its initial location. In stage 1, there is no cancer spread. At stage 2, it is spread to nearby tissues, and by stage 3, it's in the lymphatic system. At that point, it has the potential to go all over the body. By stage 4, it is actually spread to distant organs and is beginning to produce new neoplasms in these other locations. There's a classification of stages that relies on what's called the TNM acronym. T is the tumor characteristic or extent, N is the number of lymph nodes that have been invaded, and M is any tumor metastasis. And so we can use this, again, as a way to assess how far the disease spread, and this will determine the prognosis. There are many possibilities for causes of cancer. These include carcinogens, which are cancer-causing drugs. Basically, the way carcinogens operate is that they insert themselves into the genetic material of healthy tissue, and they can produce changes in genes that control cell division. Viruses and mutagens are another method of producing cancer. Viruses have the ability to insert their genetic material into our own genetic material, and this can produce a mutation, again, in a gene that controls cell division. And mutagens are similar to carcinogens, except that mutagens could be a chemical or some other DNA mutating factors, such as UV radiation or X-rays. Carcinogenesis progresses relatively slowly. It can start, stop, or be reversed. If it reverses itself, this is called remission. There's usually a continual progression. Prevention and cure depend on finding the initiating agents and reducing exposure to them. These include chemical carcinogens, hormones, radiation, viruses, and genetic predisposition. We can be born with a makeup of genes that makes us more likely to come down with certain types of cancer due to defects that were present at birth that make us more prone to developing a neoplasm. What are some other causes of cancer? Well, there's personal risk behaviors, which include exposure to the things that cause cancer. There's diet, sexual behavior, and also alcohol use. And the way that alcohol use promotes carcinogenesis is that alcohol is a solvent and it can dissolve carcinogens very easily and allow them easier access to our deeper tissues. So it's sort of an enabler. Sexual behavior, the reason that this increases our risk of cancer is because of the transmission of viruses as a result of unsafe sexual behavior that can mutate DNA and cause these neoplastic changes. Diet, if we consume large amounts of components that are carcinogenic, this can increase our risk for cancer as well. So what are some preventative measures? Well, don't smoke, limit your alcohol intake, protect your skin from excessive sun exposure, and use hormone therapy only as long as it's necessary. One of the things that hormones do is that they can go right through cell membranes because they are extremely nonpolar molecules, so that the membrane of the cell doesn't present a big barrier to them, and then they pass very easily with the help of their receptor inside the cell into the nucleus. And they can produce changes in the regulation of genes that can promote cell division. Some preventative measures are to avoid polluted air, household solvents, and paint thinners, and to monitor calorie intake and also exercise. There should also be monthly examinations. For women, breast exams are recommended, as are testicle exams for men. Another exam for men that's important is to examine the prostate gland. And for women, it's the pap smear. These are areas of the body, tissues in the body, that are extremely prone to the development of cancer. One of the unusual things about this is that if you are examining a tissue that is constantly regenerated and rapidly grows, there's more likely to be a higher cancer incidence in that tissue. In addition to that, it turns out that in cancers that grow very aggressively, that divide very, very quickly, it turns out that the common interventions, including chemotherapy and radiation therapy, that are used to attack rapidly dividing cells, will affect those types of cancers more so than cancers that divide more slowly. And the reason for this is that cells that divide rapidly are more apt to take up chemotherapeutic agents or to sustain damage as a result of radiation that renders the cell basically completely ineffective. Cancer is the second leading cause of death in the United States. The leading cause is heart disease. It affects 1 in 2 males and 1 in 3 females, and it affects people of all ages of either sex. The most common cancers are basal and squamous cell skin cancer. These are carcinomas. The most common cancers excluding the skin cancers include lung cancer, colon, breast, uterus, and prostate cancer. The prognosis is best if we treat it early, and the reason for this is that if we detect it early enough, the number of cancerous cells is low enough that the chemotherapeutic agent or the radiation treatment or whatever treatment that we engage in is more likely to hit all the cancer cells than if we wait until the cancer has the ability to spread or to grow. Routine screening is helpful in this regard. Sometimes cancer is found accidentally, and once discovered, it's usually recommended that we perform a biopsy. A biopsy is simply a sampling of the abnormal tissue for comparison to normal tissue in order to detect changes under the microscope that might indicate that these cells are becoming cancerous. Signs and symptoms include pain, obstruction, hemorrhage and anemia, fracture. Sometimes when you have cancer in the bone, one of the things that can happen is that the bone can become brittle at the site of the osteosarcoma, and this can result in what's called a pathologic fracture, where we don't realize we have the condition until we actually see this break. Another thing that we see is increased risk of infection, and the reason for that is that the immune system is generally suppressed in individuals that have cancer. And cachexia, which is simply a wasting away of the individual who's affected due to the fact that the cancerous tissue is consuming our stored nutrients. The treatment of cancer falls into four main classes. There are typically more than one approach that can be used at the same time. Chemotherapy uses chemicals to kill rapidly dividing cells, while radiation therapy uses energy to target cancer cells. Surgery removes cancer cells from the body, and the hope there is that using surgery you can excise all of the cancerous tissue. Sometimes that's not possible, and that's why these other therapies are used in conjunction with surgical intervention. Biological or immunotherapy uses the body's own defenses, its natural defenses, to fight cancer cell. The idea here is that if we can tag the cancerous tissue with a molecule that our immune system can see, then it's entirely possible that the normal activity of the immune system can wipe out the tissue before it gets a chance to grow. How do we diagnose cancer? How do we decide that this is what you have? Well, we can use imaging techniques that look at the soft tissues of the body, the internal tissues, such as MRI, CAT scan, and X-ray. We can also do blood tests, which can detect the presence of certain molecules that indicate that cancer is present. An example in men is the PSA test that's used for the detection of prostate-specific antigen, which is an early indicator of prostate cancer. And then we can also do biopsy, which is essentially a surgical examination of the abnormal tissue. And the idea here is that if we see abnormal cell shapes, the formation of syncytia, which are cells coming together and forming one giant cell, this is often an indication of a cancerous change. Also, the presence of tissue masses where normally you wouldn't expect to see them. So let's take a look at what a biopsy is. Okay, this is a brief discussion of radiation therapy.
Your doctor may recommend intensity-modulated radiation therapy, a procedure that treats certain forms of cancer to kill cancer cells or control their growth. The cells in the body grow and divide as part of the normal cell cycle. The cell's nucleus controls this process. Inside each nucleus, genetic material called DNA contains the instructions for directing this process. Sometimes the cell's DNA becomes damaged. Normally, the DNA responds by either repairing itself or instructing the cell to die. In cancer, however, the parts of the cell's DNA that direct cell division become damaged. When these sections are damaged, the DNA is unable to repair itself. Instead, the unrepaired DNA causes the cell to grow and divide uncontrollably into more damaged cells called cancer cells. A tumor forms as the cancer cells multiply and displace the normal cells. Radiation kills cancer cells by inflicting overwhelming damage to their DNA. The tumor shrinks as the cells stop dividing and die. If the tumor is in your head, your radiation therapist may make a mesh frame or mask that will keep you positioned correctly during the IMRT. Or you will get small permanent tattoos to help align the IMRT. Next, your therapist will do a CT scan of your head to get a detailed picture of your tumor and its borders. Your doctor will use the scans to specify the three-dimensional shape of your tumor and vital tissues nearby. The tumor's shape, size, type, and location help your doctor determine how the IMRT beam should be adjusted to hit your tumor and avoid healthy tissue. During your procedure, a medical linear accelerator will deliver an X-ray beam to your tumor. A computer inside the accelerator will adjust the beam with a device called a collimator. The collimator will adjust or modulate the intensity, direction, and shape of the radiation beam. This feature allows higher doses of radiation to be delivered to your tumor while sparing your healthy tissue around it. You may receive many radiation treatments over days or weeks. This allows your body to recover between treatments and to kill as many cancer cells as possible. Side effects are usually mild and occur only in the treatment area. Common side effects include localized skin irritation, localized hair loss, or inflammation and swelling near the tumor location.
And this is a brief discussion of chemotherapy. And
If you have cancer, your doctor may recommend chemotherapy as part of your treatment. The cells in the body grow and divide as part of the normal cell cycle. The cell's nucleus controls this process. Inside each nucleus, genetic material called DNA contains the instructions for directing this process. Sometimes the cell's DNA becomes damaged. Normally, the DNA responds by either repairing itself or instructing the cell to die. In cancer, however, the parts of the cell's DNA that direct cell division become damaged. When these sections are damaged, the DNA is unable to repair itself or cause the cell to die. Instead, the unrepaired DNA causes the cell to grow and divide uncontrollably into more damaged cells called cancer cells. A tumor forms as the cancer cells multiply and displace the normal cells. As the tumor enlarges, it develops its own blood supply. Since cancer cells do not stick together as well as normal cells, they may break away and enter a nearby blood vessel. Cancer cells in blood vessels may travel to other areas of your body and form additional tumors. This is called metastasis. Additional tumors may form in areas such as the lungs, liver, and bones. Another way cancer may spread to other areas of your body is through your lymphatic system. Cancer cells may enter lymph vessels near the tumor, then travel to small glands called lymph nodes. If the cells pass through the nodes, they may continue to travel through your lymphatic system and form additional tumors. Chemotherapy drugs work by targeting fast-growing and reproducing cells, a characteristic common to cancer cells. The tumor shrinks as the cells stop dividing and die. Most chemotherapy drugs work systemically as they travel throughout your body in your bloodstream. As they circulate, the drugs damage metastatic cancer cells in other organs. Unfortunately, chemotherapy drugs cannot tell the difference between fast-growing normal cells and cancer cells. As a result, these drugs also damage or irritate some of your fast-growing normal cells, such as those in your bone marrow, digestive system, and hair follicles. Death, irritation, or damage to these normal cells produces side effects such as a weakened immune system, nausea, and hair loss. The goal of chemotherapy is to reduce or eliminate cancer cells in the original tumor and any sites of metastasis. In addition to being a primary cancer treatment, doctors often use chemotherapy as a secondary treatment before, during, or after other primary cancer treatments, such as radiation therapy or surgical excision of a tumor. Depending on the location and type of cancer, you may receive chemotherapy drugs intended to circulate throughout your body, including pills, capsules, or liquids taken orally, and intravenous or intramuscular injections. Alternatively, you may receive drugs delivered only to the area of the tumor. One local method delivers drugs to your bladder or chest through narrow tubes called catheters. Another local method injects drugs into the cerebrospinal fluid surrounding your brain and spinal cord. A third local method places slowly dissolving wafers into an area where a tumor was removed. In most cases, you will receive a number of different chemotherapy drugs to increase their effectiveness. You may receive many chemotherapy treatments spread out over a period of weeks or months. This allows your body to recover between treatments and to kill as many cancer cells as possible. Common side effects of chemotherapy include hair loss, nausea, decreased appetite, fatigue, anemia, bruising, and diarrhea. It is important to rest, eat nutritious foods, and take medications prescribed by your doctor to reduce or minimize these side effects.
This is a brief discussion of immunotherapy.